welcome. Thank you all for joining us. Sorry we're running a few minutes late. I was with the Vice President who's in Colorado today. Lieutenant Governor Primavera and I welcomed Vice President Harris and Second Gentleman Doug Imhoff at the airport, and then we joined them with a meeting with small businesses at Maria's Empanadas. This is part of the Biden administration's Help Us Here American Rescue Plan tour. They were very interested in learning about what the American Rescue Plan means in Colorado. And we shared stories of how, thanks to federal help, we've been able to support small businesses, provide tax relief to restaurants, the Energize Fund, the current stimulus efforts that we're working on with the state legislature, and in addition, the health response. I joined Vice President Harris with a virtual visit at Salud Vaccination Clinic in Fort Lupton, one of the equity sites that we work with, a community health clinic to reach medically underserved populations. It's important that people know that as part of the rescue plan, American Rescue Plan, it also includes support for our vaccination sites, the vaccination effort, testing, and a number of other areas that will help us emerge from this pandemic sooner rather than later. Today, we're joined by State Epidemiologist Dr. Rachel Herlihy and the Dean of Colorado School of Public Health, Dr. Jon Samet, that will provide some updates on the trends that we're seeing in our state so that you can see at home the same information that we and decision makers see with regards to where we are with COVID currently in Colorado. I also want to update you from a call I was on with the White House this morning with the governors and the vaccine team. The national supply continues to increase. Next week, Colorado will get about 3,000 additional doses of Pfizer and Moderna. We will also get about the same number of Johnson & Johnson next week as we did this week, about 7,000 doses. They expect that will increase the week after next, and those supplies will continue to increase. We expect that the vaccination supplies hitting the state will reach the 400,000 per week level by the end of April. And so we're very excited. The sooner the better. We're ready. I'll be in Colorado Springs tomorrow at one of our vaccination sites. We have several in the metro area, Grand Junction, Pueblo, Colorado Springs. We are ready for the increased supply. Now, keep in mind, without vaccines, there's not much to run there. We might be able to do a day or two a week, or we just sort of test them out. But we really need more vaccines. Otherwise, there's just no way to do it. Currently, the current level of vaccines we actually distribute through our normal system, which means pharmacies. You can set up an appointment at a pharmacy near you, your local hospital, community health clinics. The increase that we're expecting will require these larger state-run sites for the next few weeks, which we're very excited about because we'll be able to get to the population very quickly. Everybody who wants it should be able to get it by the end of May. As we indicated, everybody will be eligible in early to mid-April here in Colorado to get the vaccine. Briefly on the trends, hospitalizations went up again today. 13 more hospitalizations, 341. Not an alarming number in its own right, but the trend that we're very worried about and we'll be watching the next few days as if this continues to increase at this rate. We could be in trouble again soon. The testing numbers are not very reliable because very few people got tested due to the blizzard, naturally, of course. So very low testing numbers and very low positives. Really one-tenth the level of our normal tests, and about just over 300 positive cases. So we'll see. The testing will come back online. Obviously, they were doing tests yesterday, today, so we should have more reliable information in the next day or two. We continue to really monitor this information every day, including the information about the variants, which we'll be briefed on here today, so you can see the information we have. We have made, as you know, tremendous progress on vaccinating the most vulnerable, those 70 and up, that represent more than 3/4 of our deaths, just under half of our hospitalizations. Currently, everybody 60 and up is eligible, and in just 2 days, everybody 50 and up in Colorado will be eligible to be vaccinated at their convenience as they get that scheduled at a local pharmacy or hospital, including people with pre-existing conditions. We are now at 77% of people aged 70 and up have been fully vaccinated. Have at least received their first vaccination. And that's very good news. Many more are becoming fully vaccinated every day as they get their second vaccine, and then 2 weeks after that, they're fully vaccinated. So we're very excited to be moving forward with continuing to get the vaccine as fast as possible to end the pandemic, to save lives. With the most vulnerable protected and entering protection in the next week or so, it's a lot less risky in terms of potentially overwhelming our hospitals. But you get to see the same information that we get to see. So with that, I'll turn it over to Dr. Samet to walk through the models that have really improved in quality and decreased in sort of the variation since the beginning. They've learned a lot, just as we all have, about this virus. So these are a lot more refined than some of the models in the early days of the pandemic. Dr. Samet?
Okay, and actually, I think we may start with Dr. Herlihy first.
Okay.
And then, yep.
Great.
Okay, we'll go to Dr. Herlihy.
All right, first slide, please. All right, so good afternoon, everyone. Wanted to provide you with a quick update on variant case trends in the state, and then provide you with an overview on where we are with cases, hospitalizations, talk a little bit about some of the trends that we're seeing in individuals that are being vaccinated, and then Dr. Samet's going to go into a little bit more detail, talking about some of the data that we're seeing and some of the modeling work that's been done in the last couple of weeks. But specifically talking about variants here in the state, we have been able to substantially increase the amount of sequencing that is being performed at our state laboratory. And so we are identifying more variant cases. So it's certainly good that we are identifying these. We have more robust surveillance available in the state, and that's a good thing at this point. But we have now 336 cases of the UK or B117 variant of concern, 11 cases of the B1351 or South African variant of concern, 225 cases of the California variant, also known as B1427, B1429. CDC has now started talking about this as a variant of concern. Previously, we were discussing it as a variant under investigation. There is some new information out. The concern specifically is primarily related to the effectiveness of some of the monoclonal antibody treatments. So again, it's being discussed now as a variant of concern, so a little bit of elevated concern with that one. And then 4 cases of the B1526 variant under investigation, and that is the variant that was identified in New York City. At this point, about 8 to 10% of the specimens that we are testing weekly in our state lab appear to be the B117 variant. That's based on a random sample of positives that are being sequenced at our state laboratory. And then another 20 to 22% are the California B1427/B1429 variant. To put that in perspective, California is now seeing well over 50% of the specimens that are positive in California coming back as that California variant. We continue to use all the tools we have available to us to protect public health and mitigate the spread of variants, including enhanced case investigation, contact tracing, outbreak investigations, all of those tools. Next slide. So I want to talk a little bit about case trends that we've been seeing in the last couple of weeks. So in this figure, each of those gray vertical bars shows you our daily case counts, and then that red line is showing you our 7-day moving average trend line. And what you see if you take a closer look towards the last few weeks of data here is that we've really reached a bit of a high plateau in the state, meaning that we're not seeing cases go up, we're not seeing cases go down at this point, we're really holding steady. And so what that indicates to me is that the actions that we're taking right now, mask wearing, social distancing, all of those types of things are really holding transmission at the level we are currently at, while we would ideally be loving to see that transmission go down right now. So this indicates to me that we're not yet at a place where we have population level protection from the vaccine. It indicates to me that we really continue to need the strategies that we have been using, mask wearing, social distancing, to maintain the level of disease transmission that we're experiencing. Ideally, we would love to see these numbers come down, and we expect them to come down as we gain more and more immunity in the state, but we're not yet there. Next slide. And then I think even greater reason for caution is the same trend in same plateau that we are experiencing in case counts, we're also now seeing in hospitalization. So if you look at the hospitalization data for the last 2 weeks or so, again, it appears that we're in a bit of a plateau. So we're no longer seeing a steady decline in hospitalizations in the state. And actually, unfortunately, as the governor mentioned, the last 2 days, we've actually seen a bit of an increase in hospitalizations in the state. We're hoping that's just a short-term trend and that we'll continue to see these numbers come down in time. But at this point, it does look like we are in a plateau in the state. Next slide. But while we're waiting for population level impacts to be seen in the state, we are beginning to see the impact of vaccine on disease rates in individuals that are being vaccinated. So this is certainly the good news behind vaccination right now. So not yet at a place where we're seeing herd immunity, population level protection, overall impact to our state level trends, but we are seeing a clear benefit to individuals that are being vaccinated. So this specific figure is comparing case rates in individuals over the age of 70 to all other age groups in the state. And what you can see here is that starting in mid-January or so, we see this growing gap between the case rates in all age groups compared to that 70-plus population, meaning that we're continuing to see a greater benefit and less disease transmission occurring among that 70-plus-year-old population. And we know that we're still in a place where we're gaining immunity in that population, so it's still going to be several more weeks probably until we see the full benefit of vaccination in that population, but certainly good early signs that we're seeing an impact of vaccine in protecting the most vulnerable individuals in the state. And with that, I'll hand it to Dr. Samet.
Okay, thank you, Dr. Herlihy. So I'm going to take you through a number of slides, including the latest projections that we looked at last week about where we might go. So if we can go to the first slide, please. So this is the results of our fitting the model, our infectious disease model, epidemic model, to the data each week. And actually here where it says current trajectory, that actually is this week's trajectory. Now there's a little bit of a lag here. It's going down, not as steeply as the line below. And what is the point for caution is what both the governor and Dr. Herlihy discussed, that tipping up of the black, the actual observed hospitalization count above the line that we would like to be on, that steadily going down line. So there's good news here in that this epidemic curve has been going down, down, down progressively since December. And then a cautionary note here as to whether this is noise, and you can see some bouncing around there, or we're seeing an uptick. And this we can't answer at the moment. We need to keep watching. Next. So this is now this same curve, and just a reminder that the infection has been quite common at our worst. Back in December, we were about 1 in 40 Coloradans infected. That's about 2.5%. Now it's at 1 in 350 or so, so we have come down, but we're still at this high plateau. The number has been much better. And if you look back to last summer, we were in the range of 1 per 600 or 700. So we are at this, as Dr. Herlihy mentioned, plateau that is higher than we would like it to be. Next. Now, this just gives us a little perspective on where we are now, where the summer is, that lowest dotted line. So the summer of 2020, you can see we had 130 people at the lowest in the hospital. Now that number is much higher. So we have a ways to go, and again, a concern is that if the curve were to uptick from this high plateau, we're starting at a point higher than we would want to be to see that kind of return of a rise of the epidemic curve. Next. Now, again, we're heading towards more and more Coloradans being immune because either they've had the infection or because they've been immunized. So the total reaching about 22% of the population immune, hopefully no longer susceptible to the SARS-CoV-2 virus. And you can see the rise that's coming as vaccination ticks up. Next. And the good news, of course, is that we are doing better and better in those who are older, 80% of those above 65 receiving at least one vaccine dose. It takes a while for the benefits to kick in, but we're not far off. Next. And then again, looking at the 65 plus, you might notice that most of the immunity in that age group is coming from vaccination, not from having been infected. But again, we, as of last week, and this will be higher this week, we're well over half now of those who are 65 plus being immune. Next. And we are starting to see the benefits. Dr. Herlihy already showed you one. At the top are the case counts in different age groups, and the plot at the bottom shows the proportion of those who are 70 plus in the hospital with COVID-19. notice the downturn in that curve over the last week. So we are starting to see the consequences, the beneficial consequences of vaccination in older Coloradans. Next. Now, this shows a picture across the state. The state is, we look at different regions of the state, local public health agency regions. By and large, we're seeing decreases or holding even across the state. Those that are red, you'll notice the R value. This is not the R naught, but this is the R as the epidemic has moved forward, so-called effective reproductive number. 3 of these regions, including 2 where skiing is prominent, the Central Mountains and the West Central Partnership, where San Miguel County is located, in the red. And in some of these counties, infection is still affecting more than 1% of the population. So the picture is variable across the state. Next. Just in terms of vaccine coverage, looking for these same regions, you can see again there's variation in the percent of the population that has received its first dose, and this is as of about a week ago. So our epidemic varies across the state, and at the moment, some of these regions are ahead of others in terms of the proportion of the population vaccinated. Next. Now, I'm going to move on to talk about the projections. So in these projections, what we do is we say, well, what if? And these are done to help guide decision-making and to say, well, what if our control of the epidemic, we use this transmission control parameter, which I'll explain, were to lapse. So in terms of integrating everything that we're doing, both the policy measures and what we're doing as individuals, masks, distancing, and so on, this TC, transmission control, integrates all that. It's been above 80, which is a good place for it to be, and that corresponds to the reproductive number being below 1 and the epidemic curve going down. So these what-if scenarios, and I'm going to show you a few, say what if there was relaxation? What if there were a change in policies or spring break hit and everybody thought it was 2019 again? So if we were to drop from 80% or so to 70% or to 60%, this was last week's projections, on last Friday, you can see that instead of going down nicely as the curve at the bottom, at 70% we kind of plateau across, and at 60% the curve goes back up. At our poorest in Colorado back in late November, December, we were heading for that kind of level, just to give you some perspective, and of course that's when our curve went up again. Next. So one question that is important is if measures were to change, our behavior would change as of last Friday, 2 weeks from last Friday, 4 weeks or 8 weeks, what difference does it make? And again, remembering that high plateau, what we want to do is have enough time to go by to get off it. And we get off it by continuing our efforts, our policies that keep transmission control high enough, our individual behavior. And then, of course, the longer we wait, the more people are vaccinated. So as you can see, if you go from the top down towards the bottom, just looking at total active hospitalizations, first going to the 60% value, or on the right, the 70% value, the longer we hold off on major changes that would affect transmission control, the more secure we are against avoiding a rise. So at the worst, let's say in 2 weeks, if you look at the curve where it says change TC to 60%, the second one down is waiting 2 weeks, and the next one is waiting 4 weeks. And you can see the substantial gap between those. Next. So these are just some numbers summarizing the difference in waiting. And if you look across, say, switching from 82%, which was last week's number, to 60% for deaths, you can see 220 changing right away, 1,024 deaths. But if you look out to the right at 4 weeks, say, that 1,024 is reduced to 328. In other words, 700 deaths we estimate, would be avoided by not changing as of last Friday, but waiting out 4 weeks. Time makes a difference. And you can see at the bottom, we've shown the same data for infections. Next. The other concern as we look at where the epidemic curve might go, and already mentioned by Dr. Herlihy, of course, are the arrival of the variants in Colorado. B117, the so-called UK strain, being the most common at the moment. If you look at the table with the dates, what we've done is said, what if the B117 were to rise the way it did in the United Kingdom, where it quickly became the dominant strain, and it's more transmissible, so it's of concern. So last week we were projecting that by about now, that number could have risen to 13%. Dr. Herlihy's figure is around 8 or 9%, and we don't see clear indication of a trend, but it's being tracked closely, and we hope that we are not on that rising curve because it makes a difference. Next. So this is now adding in B117 and saying, well, what about B117 and a lapse in transmission control? So here the dotted lines show what happens with B117, the solid lines without B117. And again, just looking at the figure for hospitalizations, you can see the jump, the rise of the curve, if B117 were to take off like in the UK, and we had a serious lapse of transmission control. So, this is being tracked carefully, and certainly we hope that we will not see the kind of rise that was evident in the United Kingdom. And on the next, just putting together, next slide, please. Just putting together, again, the same kinds of figures about what happens with the arrival of B117 as in the UK and a drop in transmission control. You can look at deaths and see out in that column 60% in B117 the impact of having B117 arise. That would be 1,500 deaths by between early March and June 1st, a substantial increase over no B117. So of concern and being watched closely. And just to finish up, next, the current picture then, the effective reproductive number is below 1. If the hospitalizations continue to tick up, we may not stay below 1, which is where we want to be. The infection prevalence is dropped. It's better than before, but it's still higher than the summer. And of course, the ultimate figure we want is no people infected, and we need to strive to get there. The longer we hold on with the current transmission control level, the better. It gives a chance for the vaccines to kick in and have their benefits. B117 and of course the B1351, the so-called South African strain, and others are of concern. This virus mutates, we know that. And some mountain regions have higher rates than others. So I think this leads back at the end to continuing our public health measures. The next slide. And I don't need to repeat these because all know this. So we need to continue on with our efforts, and of course, vaccination is key. So I'll stop here. Thank you.
Great. Thank you, Dr. Herlihy and Dr. Samet. They'll be available for questions. I want to address the concerns, obviously, with the snowstorm. There were a lot of folks who had vaccinations scheduled, and they had to be rescheduled. They were canceled for many people on Sunday, on Monday, some even on Saturday. The healthcare providers are reaching back out to you. If you signed up through Kaiser, they'll reach out by text or secure email to get another appointment this week. UC Health had about 2,500 scheduled appointments at 11 locations. They are calling and texting patients to reschedule for this week. SEL is notifying patients by phone and text message to reschedule appointments for them next week. As you know, the state also partners with the community organizations. We run a number of vaccine equity clinics, and there were 15 clinics including 3 for people receiving their second dose, that are rescheduling. And you can see the updated dates and times for each of these vaccination clinics on this slide. Nobody should be worried if you miss your second dose by a few days. There's a window that you of at least 2 more weeks. You should get it within 6 weeks of the first dose. It really doesn't impact the efficacy to delay that by 3 or 4 days or a week, and that's consistent with the CDC guidelines. So there were 3 second dose clinics and 12 first dose clinics. Those are all being rescheduled, and you can see where you can get that. We are also rapidly in the process of launching the state pods, Colorado Springs, metro area, the Ranch up north, Grand Junction, Pueblo. These are going to be the larger scale vaccination sites that, as the vaccine quantities increase, we're beginning to see some of that surge capacity in these really easy to use sites. The vaccine is free everywhere. There is no copay. You do not need to furnish a state ID to get it. You can simply go in. It's nice if you bring a state ID or insurance card. It certainly helps them, but they cannot deny it to you just because you don't have that. We are not requiring that sort of proof of residency or where you live. It's available to everyone here because this is a public health crisis. We want it to be available to you. So if you're 16 up, and in 2 days it'll be 15 up, go in and get it. People with pre-existing conditions as well. So while we work on to control what we can, it's important that we continue to live in this sustainable way a bit longer as we get folks vaccinated. And by this summer, I'm excited that things will be relatively back to normal, and that's a good thing as long as we're doing our part as a state. We're going to be offering these vaccines. You have to do your part. You have to get the vaccine when it's your turn. So those are the 2 pieces that go hand in hand. If we offer it and no one comes, it doesn't help anybody. So right now, demand still exceeds supply, which is great from our perspective. Not great from yours because you may take a week or 2 before you can get an appointment. But we expect that those 2 lines will intersect at some point, probably in late April, early May, where supply might actually exceed demand, and then it'll be focused on how we can make sure our neighbors, our friends, our family are protected. The state is ready to engage more thoroughly in that communications campaign about the benefits of protecting yourself. Thank you for everything you're doing, wearing a mask, socially distancing, getting the vaccine when it's your turn. Together, we'll get through this soon in the next few months, and we will move forward and build back stronger than ever. With that, happy to take some questions. Phone?
Hi, this is Taylor Summers for NBC News Radio in Colorado. This is for Dr. Herlihy and Dr. Samet. Novavax released data from its recent clinical trials in the UK, which showed its vaccine was 86% effective against the B1526 variant and 96% effective against the original strain. It'd likely still be several months before it would be able to get approval in the U.S. Would this potentially help Colorado moving forward, even as we're able to get on track to vaccinate all adults by mid-April?
Just to be clear, end of May was when everybody will be able to get it. But go ahead.
Yeah.
Finishing, yeah, starting mid-April, finishing in May. Yeah, go ahead.
So absolutely. I mean, I think at this point, we are eager to see the number of doses available of whatever product that, the FDA has reviewed and is shown to be effective available here in Colorado. So yes, I think we welcome additional vaccines coming to market, and I'm sure the governor would comment on that as well.
Yeah, the more the merrier. I mean, I call upon the FDA to act expeditiously and approve it, given the evidence. They should fully allow the evidence from the UK and Europe. There's no physiological differences. In my opinion, there already are vaccines being used in other countries, and in my opinion, should be already approved here, and we could end this pandemic sooner if the FDA moved quicker and understood that this is an enormous public health emergency, and they need to weigh the costs and benefits, which come down firmly on the side of some things we've asked for, like allowing remaining doses to be put together under clinically supervised conditions. Of course, approval of other tools in fighting this, and other things that they can do to expedite the end of the epidemic.
PBS4 here. You talked about the 400,000 Johnson & Johnson doses and kind of talked about the mass vaccination sites. Is there a timeline for the mass vaccination sites? Could we see that within the next few weeks? And then does that tie directly with the Johnson & Johnson vaccines or any vaccines coming into state?
Yeah, so the quantity of Johnson & Johnson next week is only about 7,000 for Colorado. The week after next is when we anticipate significant increases in quantity. The pods, the state pods are ready sooner, meaning we're going to be running people through in the next week. Some might come on the week after next, but as I said, Colorado Springs, Denver, northern Colorado, Mesa County, Pueblo County, they will all be operational within the next 2 weeks, and some of them are coming online in the next few days. But we need the increased quantity. They will have some quantity, in the coming days. There will be increases in quantity of all three of the approved drugs. So Johnson & Johnson will be the most pronounced increase, because it'll go from 7,000 to a much higher number the week after next, and stay there for a few weeks. Moderna and Pfizer continue to ramp up at a regular basis.
Dr. Herlihy, there's now the 11 variant cases of the South African variant. Are all of those in the Buena Vista Correctional Complex? And then, Governor, I wanted to follow up on a question I think I asked last week about vaccination rates among prison guards. You had said that you were looking to increase those. Have you taken any tangible steps, and what's being done to increase those?
So to your first question, so there's one that we are investigating right now that we don't yet know, but it's an individual we haven't been able to interview yet. So we're waiting to conduct that interview to find out if that individual is affiliated with the Buena Vista complex. But they are all in that geographic area.
And we'll have to have Department of Corrections get back to you. We've certainly given them several ideas about how to increase that, and they would also have the latest updated information on percentage of prison guards, and so we'll be happy to connect you with their information and PIO.
Good afternoon, Governor. David Clue with Denver 7. A different COVID-related question, if I could. A recent audit conducted by the State Auditor's Office found a massive backlog of unprocessed unemployment claims at CDLE that may represent at best overpayments, and they say at worst fraud within the department. What's your reaction to this report, and what action might your office take to remedy this potentially costly issue?
Well, first, I'll look forward to reviewing the report over the next few days, but my administration is partnering with the Attorney General to identify and prosecute any criminals who engage in this fraud. We've also had calls in past weeks, obviously before the report, last 2 weeks, with Department of Treasury and the federal branch of other federal law enforcement. A lot of this is interstate, some of it is international, some of it is also domestic within our state. But we will do everything we can and cooperate fully to track down and hold accountable criminals who defraud the government or who defraud beneficiaries.
Hello, Governor. Jesus Carrasquel from Noticias Univisión Colorado. Gobernador, ¿podría decirnos cuál es la siguiente fase de vacunación en el estado? ¿Quiénes se verían beneficiados y si tenemos suficientes dosis para todos?
Sí, este viernes, el 19 de marzo, todas las personas mayor que 50 años pueden recibir el vacuno. Todas personas mayor que 50 años pueden recibirlo. Las personas más de 50 años y también trabajadores en primera línea como los trabajadores en restaurantes pueden recibirlo después de este viernes 19 de marzo. Vamos a abrir el vacuno para toda la población en la primera parte de abril. Vamos a tener la fecha exacta muy pronto, próxima semana.
Excuse me, Mr. Governor, Charles Ashby from the Grand Junction Daily Sentinel. Notwithstanding what two doctors said about wanting to continue the social distancing and mask orders, as you know, the counties are chomping at the bit to open up as soon as possible. You have said that you want to devolve the COVID dial or change it and eventually get rid of it. Where are we at with that? When do you expect that to happen? Do you think mid-April would be a time that might happen when more counties get more of these vaccines into people's arms?
Yeah, absolutely. I think that effort to devolve to the county level continues. We already have, of course, a variance process where, counties can get the flexibility that they want. But I think the default will become going to the county level, relatively soon in the next few weeks. And that's because the state nexus in this and sort of what is our emergency is preventing hospitals from exceeding capacity. And we've done that successfully. They haven't in some states. As long as, counties are not exceeding their hospital capacity and COVID patients and non-COVID patients in need of hospitalization are dying needlessly, we encourage that kind of flexibility at the county level. So there'll be more information next week on exactly how that devolvement will look and the time frame and how that works. But clearly, as more people are being vaccinated, what a lot of this, data shows that while there is, of course, more difficulty ahead of us, more loss, more hospitalization, the danger of exceeding our hospital capacity is rapidly decreasing.
So if I could do a quick follow-up, I know you just signed or extended the mask order back on the 5th, I think, and obviously that's going to be coming up in the early part of April. What are you thinking about that? Are you going to continue that mask order? Or are you going to make it fit in with all this that you're talking about with the dial?
Well, so the mask order is not directly related to the dial. I think it's going to be important for people to wear masks for the next few weeks and months. I think as people are vaccinated and protected, it's not as important to wear a mask. I'm vaccinated. I'll continue to wear a mask around others just to set the tone. But I think for most folks who are vaccinated, that offers a very high degree of protection, more than a mask. A mask is 50%. The vaccines are 95%. We don't yet know if they decrease transmission by 95%, but they do certainly decrease infection by 95%, and they decrease death by as much as 100% in many of the studies. So I think the long and the short of it is next week we'll have more information on how the protocols are devolved to the local level. And we'll look forward to working with Mesa County and the rest of the state to help tailor the appropriate public health response to the pandemic in the final months.
Thank you, sir.
Hello, Meg from the Denver Post. This is probably Dr. Herlihy or Samet. With the uncertainty about what the trajectory is doing right now, do you say to the general public, do we need to keep doing what we're doing now, or is it a time when we need to start being even more careful?
Ed, if you want to start.
So tough question, and one of course where we want to know with what we're observing, what direction things are going. I mean, if this is some noise and some bouncing around as we're at a plateau and we continue down, that would be good news, and I think we would stay on course to look at how we can begin to make changes that we all want. If it's going in an upward direction, then I think then there'll have to be a discussion about where we are, certainly a reminder to Coloradans about the need to continue to wear masks, maintain the distancing, doing all the things that we seem to have done quite well for the last few months. And whether other measures might be needed, I think would really depend on what we see. I think over the next few weeks, again, we'll continue to see the benefits of vaccination come in, which I think will be really important. And for now, I'm just hoping we're just seeing some jumping around at this plateau point, but that will become much more clear, I think, with about another week of data.
Thank you.
Hi again, this is Seth at the Colorado from Denver. Two questions. First, early, you said that surveillance is increased on the roads. Can you talk about what that means, to what degree is it increased? And two, does the potential for variants to really take off and make the situation worse, is that giving CDC or the state any pause on changing the dial or opening up the potential for counties to move to blue? Thank you.
Was that for Dr. Herlihy?
Sorry, yeah. So the first one certainly for Dr. Herlihy, and the second one for you or either of the doctors would like to answer.
Sure, so I can start. So as Dr. Samet was just explaining, we have the benefit in front of us, which is vaccination in a growing immune population. And what we expect from that is to see an impact, a positive impact on disease transmission, hospitalization rates, mortality rates in the state due to COVID-19. But the challenge we have before us is variants. And as variants become more widespread, there is the potential that we could see more transmission. And so I think, this is the reason why masks continue to be important, as the governor was just saying. Social distancing continues to be important. But we know that vaccines are here. We know that they are effective, and we know that there's going to be an impact. I think we just need to be patient and build that immune population and get to a place where Colorado has herd immunity to see the full benefit.
Oh, I'm sorry, just to follow up real quick, Dr. Herlihy, the second question was to what degree surveillance has increased?
Over particular to variants?
Yes, particularly to variants.
Sure. So the number of specimens that are being sequenced at our state lab now is close to 400. So in the last 2 weeks, it's been 300 to 400. Before that, we were doing closer to 200 or even less, a little less than 200 per week. And so because of that, we're able to now meet our goal, which has been 5% of positive specimens in the state being sequenced. So as we've been doing that, we do have this random sample, our Sentinel surveillance network, where we are tracking the percentage of positives each week that are being identified as different variants. And as I mentioned at the beginning of my presentation, we think that number for B117 is around 8 to 10% right now. When we first started tracking B117 in the state, it was in the 0 to 3% range. So we certainly have seen the prevalence of the UK variant or B117 variant increase over time. As Dr. Samet mentioned, the modeling team is helping provide us projections of what we would expect the prevalence of variants to be in the state if we were growing at the rate that the UK is. We've been trailing behind that, which is good news, so haven't quite kept up with the rate we estimated could happen. So that is certainly good to see at this point, but we are seeing an increase in prevalence of these variants in the state.
Hi, this is Kagan Harsha with Fox 31 and Channel 2. This is a question for any of you, but we're getting a lot of questions from people in this 1B4 group who are asking if they can sign up for a vaccine prior to their eligibility date on the 19th. Should these folks be looking now? Can you sign up now? And we also know a lot of people are signing up anywhere they can. What's the state's advice currently in regards to signing up on multiple platforms?
So we have advised our partners to update their appointment sites and ability to set them up by tomorrow, by Wednesday. At the latest, meaning that many sites and many partners will let people in 50 and up, for instance, schedule appointments on Thursday or Friday. But certainly by Friday they should be there. So they won't all necessarily be updated by Friday, by Wednesday. By the date it goes live, which is Friday, those who are 50 and up and eligible under other criteria, pre-existing conditions or frontline workers should be able to set up appointments. So the goal is most of those partners will have that online by tomorrow. Some will be Friday at the latest.
And the follow-up, because there are a lot of people still signing up at multiple sites, multiple pharmacies. Is that recommended? Should people avoid that? Is that creating problems?
Well, you can certainly be on as many lists as you like. It'll take a few weeks to get through everybody in an eligible group. So if you're 50 and up, you become eligible Friday. It doesn't mean that everybody that's 51 can get it Saturday and Sunday. There's not enough vaccines. It'll take several weeks to get through everybody who's 50 and up. So you can certainly sign up in a site and you'll get a chance to get the vaccine. It could be in 3 days. It could be in 12 days. It could be in 16 days. If you're particularly frantic about that difference, like you really want it in 3 or 4 days and not 15 days, then sure, you can sign up on multiple locations, and that's fine too. Once you do get a vaccine appointment and get vaccinated, it would be nice to others if you canceled your remaining signups on other sites so as not to clog up the works. Thank you all.